Idaho Governor Brad Little signed Senate Bill 1380 into law Monday. The bill will create a new Office of Health and Social Services Ombudsman, which will be a self-governing agency, independent of the Idaho Department of Health and Welfare and the Idaho legislature. An ombudsman is a neutral, independent public official or office tasked with defending the public's interest in investigating complaints about the actions of public institutions. More than 100 countries now have some type of ombudsman. I believe the idea of having an ombudsman is simply genius. The idea that a government agency can hold another government agency accountable sometimes is asinine, especially when a government has been under investigation repetitively for the same egregious mistakes. But let me be clear about this. This is not a paperwork mistake. See, these are actually lives on the line. And Idaho has it right with creating a separate entity that can seriously investigate without being afraid of losing funding and position of power. Just offering opinions are just conjecture over coffee. So it's always important to offer solutions. I believe that the federal government must step in if lawsuits and deaths are happening within the state's border consistently. I know that this could hurt the families of the poor acting states, but a subpoena to the Human Service Secretary could be sent to ask questions about a state in question. This is possible where states can lose funding because of noncompliance. An article states that Sally Kisting, the Pulitzer Prize-winning investigative reporter, said that Mission Hospital remains out of compliance with federal regulation in 6 areas, and is still at risk of losing Medicare and Medicaid funding, according to a letter sent to the hospital CEO Friday. A reporter, Lucius E. Wright, said that Alaska is in risk of losing $425 million. The State Education Committee held hearings last week after the Department of Education sent a letter on March 27 to the DOEED stating it was not in compliance with the conditions of receiving the funding. If a hospital can lose funding, a state can at least be threatened to lose funding if they cannot get their Division of Family Services under control. I'm thankful that Governor Little is serious. You know, when you have a real leader in the governor's house, see, they invite an ombudsman. They will invite a watchdog group. They'll put their ego to the side and realize there is a problem in the agency within their own government. We are trying to save kids, not save an agency's funding. We are trying to save families, not save someone's position or bureaucracy's policies when it's outdated and simply inadequate. This is foster care. It's us care. It's world care. It's God care.